Senior Moments, sponsored by the Empowering Seniors Group on News Talk KVNU, 102 FM and 610 AM.
Good morning and welcome to the Senior Moment Show. My name is Bruce Lee. I am here with my co-host Sid Roeder. Good morning, Sid.
Good morning, Bruce.
How are you today?
I'm doing fabulously. How about you?
Fabulously. I'll go with that. Fabulously. Yes, it's good to be here.
Have to mix it up once in a while, right?
Yeah, that's a good one. It's not awesome. It's not great. It's fabulously. That's very good. All right. Well, we are excited for our show today. We have Lauren Tree. She is the founder and a partner at Living Tree Medical Group and Urgent Care, which is in Providence, correct?
That's correct.
Welcome, Lauren. Glad to have you here. Before we get started and get to know her a little bit, why don't we talk about our sponsor, Sid?
Absolutely. Our sponsor is the Empowering Seniors Group, which is a group of professionals that has dedicated their time and efforts to provide seniors and their family members with information. We do so via this radio show. If you would like to learn more about the Empowering Seniors Group, you can do so online at empoweringseniors.info, or you can email us at empoweringseniors.cv@gmail.com, and the CV stands for Cache Valley. And lastly, if you have any suggestions for this show, anyone you would like to see us invite, call me personally at 435-512-6406.
You wanted to say empowering info.
I definitely wanted to say something else than I did, I guess.
Well, I hope that this is empowering info. That's what we're trying to do, right? Get information out there to people, help them understand what resources are available to them in the community. I guess to that point, we'll welcome Lauren again. Lauren Tree. And again, her company is Living Tree, so there maybe is a relationship there.
There's a little bit of a relationship there.
Yeah, yes. Living Tree Medical Group and Urgent Care, which we're going to learn more about that in just a second. Before we do that, though, let's meet Lauren and find out a little bit about you and why you are doing this.
Yeah, so I have always wanted to be in the medical world since I was little. I've always been fascinated by medicine, and but it just didn't seem to happen for me for many years. I ended up I grew up in the South and ended up marrying a military man, and so I was never really anywhere a super long time. And so I kind of put off that part of education to have babies, move around, have a family. And so I was a stay-at-home mom for about 10 years. Then I decided in my late 30s to go to nursing school. And I graduated when I was 40. And then just basically throughout that whole process of being in school and in all the facilities that I had to go into for clinicals, I started to see a trend of problems.
And what kind of problems were those, Lauren?
So I saw three recurring problems, and it had to do with the people there. So the providers seem to be rushed. They're not happy in what they do because corporations are telling them you have to see a patient every 5 or 10 minutes. And we know as patients that is not that's not enough time to really sit and talk about your health care and the needs that you have. I mean, I've been to providers before where I walk out and go, dang it, I totally forgot to ask them about these other 3 things. And then there's this barrier between you and your healthcare provider that you're not able to just talk to them without busting through all these barriers. So you see provider burnout. Providers who just start to, I'm not saying they don't care, but they just get burned out, and it's hard for them to really see you in a way that makes you feel like you're cared about because it's so short on time. So providers being the first thing I saw. And the next thing I saw was in the staff, so nurses, CNAs. They weren't happy with their jobs because they just felt like a number to the corporation. And or they were overworked, or they're picking up extra shifts, and a lot that goes into just being a happy employee, and creating that culture of treating your employees and each other like family. And then the last thing that I saw with the patients that I interacted with, and they are, of course, not happy with their care because they don't get to spend time with their provider. Sometimes staff members can be short with them or snarky because they're, overworked, and they kind of lose that caring feeling sometimes. And then patients also have no transparency in their medical care. They don't know what they're going to have to pay. They don't know how long they're going to have with their provider. They don't know how to get in touch with the provider if they have questions. And so those are kind of the three areas that I kind of saw that pattern of it's just not working. It's just
then
not.
You feel like there's an opportunity there for
yeah.
change. So tell me, before we get to the Living Tree part of what you've created here, tell me more about what your healthcare experience is. You mentioned you went to school, you got a nursing degree. What's your hands-on experience?
So I worked as a CNA for a little bit at Brigham City Hospital, Med-Surg and IMC. So I did that right before nursing school. I worked in registration at Cache Valley Hospital as the ER registrar. And then I was in nursing school, and I worked in labor and delivery for the month of my last rotation and loved that. And then I work doing home health and hospice at night.
So working through all of that and seeing that recurring problem, how did you come to the solution part?
So I have very much an entrepreneurial spirit. And I really thought, why can't we solve problems? Why do we all have to sit around and just complain about that there are problems and nobody's fixing it? And so I got some pushback with people saying, oh, you're not going to solve the healthcare problems of the world. And I said, well, I can at least try to influence it in my own sphere and then let it grow from there.
And thus Living Tree, or the idea for it, was born.
Yes.
Okay, and so let's kind of jump into what Living Tree is. So it's located in Providence, right?
Yes, we have a location in Providence. We have an urgent care and a family practice in Providence, and then we have a family practice in Logan.
Okay, and for the listener who is still maybe kind of wondering, what does the solution look like for the client?
So the solution for the client is that we let the providers kind of set their own tone for their patient. So if the provider wants to spend 30 minutes or an hour with their patient, we give them the freedom to do that. And freedom is huge. The culture of what we do is huge for us. Like, we want to make sure the providers have that choice, and that the employees have a really great place to work, and that they feel loved and appreciated. And to my employees, I always tell them family first. So if you have something going on, we want to support you in your family events and goals. And this is a supplement. This is not something that is your whole life, and we don't expect you to flush your family for work. We're really family friendly.
Yeah, thank you, Lauren. We're already coming up on our first break here. Again, let me mention our sponsor, which is the Empowering Seniors Group. If you'd like to learn more about the Empowering Seniors, you can do so online at empoweringseniors.info, or you can email us at empoweringseniorscv@gmail.com, and the CV stands for Cache Valley. And lastly, if you have any questions or suggestions for the show, you can call me at 435-512-6406. We're going to take a little break. Stay tuned.
This is Brian Erickson for the Sunshine Minute. Each day, our nurses, CNAs, cooks and servers, housekeepers, laundry staff, music, recreation therapy teams, office staff, receptionists, and many more arrive around the clock. These heroes show up ready and willing to serve and protect our residents and clients. We are so grateful to our dedicated team. On behalf of the Board of Sunshine Terrace Foundation and our community, thank you to all of our employees for keeping us safe. We bring more to life together.
Did you know 10,000 baby boomers qualify for Medicare every day? Did you know that you'll start to get swamped with mail about Medicare 6 months before your 65th birthday? Did you also know it doesn't cost anything to use an insurance agent to help you navigate through all those offers? Hi, I'm Tracy Ferris with Blue Water Health Insurance. Let me help you understand all the offers you're receiving and find the plan that fits best for your situation. Call me today at 435-890-8155.
You have a lot of options when it comes to buying or selling a home. Do you list it online, sell it yourself, or do you have a realtor help? It's a major financial and emotional decision. A realtor is the liaison between buyers and sellers and really helps you navigate complex contracts, deadlines, and disclosures.
Hi, this is Sid Roeder with Achievement Realty.
I work for you to get the best outcome for your situation. Let me earn your trust with a free consultation and a free market analysis. Call me today at 512-6406. Then list it, sell it, and move on.
Welcome back to the Senior Moment Show. If you're just joining us today, we're speaking with Lauren Tree, who is the founder and a partner at Living Tree Medical Group and Urgent Care in Smithfield. Smithfield. What am I thinking? It's not in Smithfield. There's lots of good things in Smithfield, but Living Tree is not there. That's not one of them. They're in Providence. And I guess that's a good segue into saying, tell us about your contact information. Where are you located and how do people get in touch with Living Tree?
So our Providence location is at 169 North Gateway Drive. It's Suite 170 and 175. That's the urgent care and family practice in Providence. And then our Logan location is 1219 North 400 East in Logan, and that's right across from Logan Regional on 400. Our phone number, you can text or call, is 435-565-6043, and all that information is also on our website at livingtreemedical.com.
That's great. So let's talk a little bit on what is probably most relevant to our listeners. Is there a fee to use you? Do you accept health insurance? How does that work?
Yeah, so we accept all major and some minor insurances, and we also have a subscription service that we offer for our urgent care. So
I'm curious. You know, this is kind of a mission for you, the way you've described it. I mean, you spent time as a mom, raised kids, had those experiences going to doctors with your children, got into the medical profession as a nurse, had experiences there, and that drove you in your entrepreneurial spirit to do something different. So as you think about that now as a patient walking into Living Tree, what would I observe that's different about you? What would my experience be that you feel like would be different that you've tried to accomplish now?
Yeah, I think it starts with our staff. I mean, they are an extension of Living Tree. You know, they are what makes the whole experience pleasant or unpleasant. You know, it's just kind of par for the course for any company. I think we have the best staff. They are amazing. They're cheerful. They really do care, and they portray that. And so that is the first thing, at least, that you'll notice when you come in is just the warm greetings, and we pass out chocolate too, so that's helpful.
Ooh, that's wonderful.
I know, right? We have the treat basket for all the kids that come in. Our doctors are amazing. They will spend time, and they are knowledgeable. They are plugged in. Dr. Duke, Dr. Welter, we have Dr. Maloof, Savannah Alder, and Jen Mosteller, in addition to our urgent care providers. And I love all of them. Like, I would go see any of them. I would trust them with my kids. They are just, I think the one thing that really sticks out to me about a provider is when they listen, and they really care, and they try to really figure out what's going on with you. Because not all doctors are going to know all the things, but they can say, hey, I can figure this out. And then a lot of times our providers will call patients directly instead of having somebody else do it. There's not this big barrier between patients and providers. And then, you can access all of our providers through our online portal. and talk to them there. And I feel like also a big difference that people are starting to learn. I kind of feel like when you go into a medical office, sometimes your walls are already up and you're already ready to be aggressive because you know that in order to get good health care, you have to be a little bit aggressive before people will go, oh, they're serious. They actually want us to care. Okay. And so we will make mistakes. Everybody makes mistakes. I want to be different in the way we handle everything, how we fix things, how we take care of people. So, I am always accessible and I'm always willing to help people navigate their health care.
So has that changed the process on how you deal with your patients a little bit too? Are they more explicit when they call in to make an appointment so you have a chance to better set aside the time that they need, or how does that work? Have you seen a transition there?
Yeah, so we have patients that are, when they call in, we ask them, what are you being seen for? And then we have people who, if they express concern over, hey, like going back to my, to a patient with diabetes, they're newly diagnosed. They need to know about diet and medication and managing that and exercise. And there's so many questions. And so we can set aside a larger amount of time for that patient to get the care that they need. And like I said, our appointment times are usually a little bit longer than normal for some of our providers. And then, like I said, they can be extended based on the need of the patient. And that is something that we really push our providers to practice the way that they want to practice. And if they feel like they want to spend more time with their patients, then they do. And I think that's a really positive thing for a lot of people. It's just they will be listened to and taken care of.
So let's talk a little bit about how you're set up, because it's a little bit different than maybe a traditional medical office, right?
Right.
Because you are, the way you charge, the way people interact with the office is a little bit different. Talk about that.
Yeah, so Living Tree offers a subscription service for our urgent care. And that includes unlimited urgent care visits for an individual or a family. We have two different options. The individual is $55 a month. The family is $110 a month for a family of up to 5.
So does that, what does that include?
So that includes unlimited urgent care visits.
So I could, for $55 a month, I could come to your office every day if I needed to.
Yep.
You wouldn't like me, but I could do it.
I would love it. Come see me every day. I mean, you can be seen every day. You could bring in your kids if all of them get sick, and it's like, 5 days in a row. They kind of fall like flies sometimes with these colds and everything that's going around. So the visits included. Things like stitches are included. The only things that we really charge for are labs. So you get really, really good discounted labs, and then X-rays. X-rays are $15. We have a lot of labs for $15. Our basic ones that you would run on like just a physical. All of those are around the $15 range. When you get into hormones, they're a little bit more, but not much. And then, that's the nuts and bolts of it.
Thank you, Lauren. Before we head out into our second break, maybe just give our listeners a chance to jot down your telephone number one more time.
Yeah, our number is 435-565-6043, and you can call or text.
Thank you, Lauren. This is the Senior Moments Show. We're going to take another break. We hope you stay tuned. We'll be right back.
Did you know that one of the greatest threats to our quality of life is a fall? 1/3 of Americans 65 and older, and 1/2 of those over 80 will fall this year. Many will never be the same again, and some will never return to their homes. This is Bruce at Comfort Care. One of the ways we can help people stay in their home is through our free in-home fall protection survey. Let us help you identify these fall risks. Call us at 754-7676. Comfort Care, 754-7676.
Reed's Pharmacy in Hiram offers free delivery service 5 days a week, Monday through Friday throughout the valley. Just stay home and they will deliver to you. With 25 different suppliers, they won't have the shortage that others might have. Also, with compounding and many other services, they will be able to serve all your needs. In order to stay safe and help slow the spread, please call Reed's Pharmacy in Hiram at 245-DRUG and they will take care of you.
Hi, this is James with White Pine Funerals. We're excited to host our annual holiday concert featuring a choir and musical ensemble by Jay Richards. All are welcome to attend free of charge. We extend a special invitation to anyone who is missing a loved one this holiday season. Food donations are encouraged at the door for the Cash Food Pantry. Back-to-back performances will take place at White Pine on Thursday, December 1st at 7 p.m. and 8:30 p.m. That's Thursday, December 1st at 7 p.m. or 8:30 p.m.
White Pine Funeral Services, here when you need us most.
Welcome back to the Senior Moment Show. If you're joining us just now, we're speaking with Lauren Tree, who is the founder and a partner at Living Tree Medical Group and Urgent Care in Providence, which is just down by right before the roundabout, right there, right?
Correct.
Just to the north of it, a little bit on the west side of the road.
Yes.
And we've been talking about a lot of different things. Lauren's an entrepreneur and a nurse, and she wants to create something different, a different experience for families and individuals that want to, how they access their medical care. I guess to that end, there's lots of traditional ideas out there, and there's lots of employment, people that are employed with different benefit programs. How does that work in the community? If I'm just working someplace, do I have normal access to you? Do I have to do something different? Will my insurance cover you? How does that work?
Yeah, so with our urgent care, we do have those subscription services like I was talking about earlier. We do offer bigger discounts for employers who want to offer this as a medical benefit to their employers or employees. And we can, I can talk to the HR manager or whoever about this. It's a really good option for people who are a small business who can't afford to give, the big health insurance plans, but they want to offer something, or the ones who can afford to give them the big plans, but they're high deductible. And this is a really good filler because you get those unlimited visits. It covers all of your day-to-day stuff, and it's a really good option.
Are there any limitations on that, Lauren, in number of employees or minimum number of employees that you have?
The minimum is 2.
Okay.
So, if it's a husband and wife or if it's just you and one employee, that's our minimum to get the discounts. And then the more employees you have, the bigger your discounts are. There's not a max, but if we got to a certain point, then we'd start looking at opening other locations to help support more patients.
Okay, great. I mentioned that the office is located just down in Providence, but there's also one in Logan as well. That's directly across the street from the hospital, like right across from the Budge Clinic, right?
Yes,
almost
it's a
directly
little bit further south, but if you walk out our front door and look left, the hospital sits right there.
Gotcha. Yeah. Okay. You guys do some community service.
Yeah, we are involved in a few different things. We work some with iHelp. They're a group that was formed here and run by local people, doctors and just other people who want to be involved. And they do medical mission trips. They go to Africa, and then there's one coming up in Guatemala. And some of our staff go and do that, and then we also we take donations for different things to take over. People have donated dolls and blankets and things to give out to kids. And then we also are this year going to be we're going to adopt a bigger family of I think 8 kids is what we've decided on. And then we're asking for our patients and anybody who wants to participate through Families Feeding Families. And we're going to be giving out specific kids. I would hand out something that says 8-year-old girl, favorite color's blue, here's her favorite things, and then bring back gifts to the clinic, and then we can put it all together, make sure everything looks good for the whole family, and then fill in gaps with...
Is that at both locations you're doing that?
Yes. Yeah. So if you want curbside service, we can bring something out to your car. You can drop stuff off, and we'll put a phone number out on our clinic that you can just call, and we'll run out, grab it, put it in our box, and then at the end, I'll put my mama eyes on and look at everything and just make sure it all looks fair and even and good. You know how we do it, where we're just like, dang it, that kid got more. And then I'll even it all out at the end and then make sure it's good for the whole family. So like I said, this family has we're doing one with 8 children, and we're going to hopefully make it a really good Christmas for this family.
So I'm just curious, how did you locate that family?
Jamie is the, I'm assuming, founder. If she'll correct me later, I'm sure. But Jamie created Families Feeding Families, and I just keep in contact with her because we do, through iHelp, we do a free clinic the third Thursday of every month for the refugees. And then we're trying to get involved with other organizations who have people in need for medical care. I think it's a big issue for like CAPSA and a few other places that we're trying to help. And so when I was talking to Jamie about it, I offered to them, hey, if you find somebody that needs medical care, let us know and I can help with, if it's supplies, if it's just being seen. I'm happy to help people. And so they run a Facebook group, and it is an amazing support organization. They're from here. They don't have a lot. But it's a really heavy donation based. But they do all of these wonderful things. They have porch pantries that people can go to. Of some of the people who run it, they have their houses where they set up the little pantries, and so we try to do as much as we can for them, with them. And this is one thing that I wanted to tackle this year with them, is to support a bigger family.
This question's totally unfair because we're out of time almost, but what's your favorite thing about Living Tree?
The people. I love our people. All of them are amazing. Our patients are amazing, but I have the most wonderful staff ever. They're awesome.
Thank you for coming in, Lauren. Again, this is the Senior Moments Show, visiting today with Lauren Tree. She is a founder and partner of the Living Tree Medical Group Urgent Care in Providence. Maybe you want to let our listeners know your phone number and address one more time, Lauren.
Yeah, our phone number is 435-565-6043, and our address is 169 North Gateway Drive, Suite 170 and 175 in Providence. And then our Logan location is 1219 North, 400 East in Logan.
Thank you, Lauren, for coming in. This is the Senior Moments Show. We hope you tune in again next week.